Ethical Decision Making, a strategy project by Jared Capps, Takia Marshall, and Anna L. Powell. This project will utilize evidence-based research to reveal two strategies an APRN may implement into practice to meet the competency of ethical decision making. Evidence utilized will be peer-reviewed, current literature, and all within 2 years. Evidence-based practice is utilized by healthcare providers and organizations to improve quality, patient outcomes, and patient care based on most current findings. We will use evidence-based practice in this project to provide the most up-to-date information on ethical decision-making for APRNs. Advanced practice registered nurses are master's prepared nurses that are highly educated and patient-focused. APRNs are able to provide and direct care with the ultimate goal of improving patient and specialty population outcomes. APRNs have the ability to specialize and focus on a specific role. Some examples are nurse practitioners, certified nurse midwives, certified registered nurse anesthetists, and clinical nurse specialists. Each have their own focus and role in the care of patients. Ethics is defined as a field in philosophy that aims to individuate the rights and wrongs by trying to understand the nature of morality. Berggren defines making an ethical decision as in a situation where there are conflicted options, a logical process in which deciding morally the most accurate action by thinking systematically. Ethical decision-making focuses on two areas, processes and outcomes. Process evaluation is an overview of moral disagreements, interpersonal skills, interactions throughout conflicts, and problems during resolution. For an example, some parents are at their child's primary care doctor appointment and refuse the child's immunizations. As the APRN, you understand that it is beneficial to the child to receive these vaccinations. It is important to listen and understand the parent's reasoning for refusal. And then we decide the best course of action, which would likely be education. Throughout this conflict, we can only accept the parent's decision as it is their right to refuse. The only thing we can do is explain the benefits of accepting and the consequences and risks of declining. Outcome evaluation involves short and long-term consequences of actions taken. The patient must be satisfied with the chosen solution. Whether the parents come to the conclusion that immunizations are indeed the best choice, or they continue to refuse, the outcome may not be what we believe to be best. It is important for the APRN to determine what could have been done differently and how to prevent situations such as this from happening again. Ethical problems require moral judgment and making choices. Lack of knowledge, confidence, skills, and time are internal barriers that can inhibit the APRN from providing ethical care. It is important that the APN Ethical problems require moral judgment and making choices. Lack of knowledge, confidence, skills, and time are internal barriers that can inhibit the APRN from providing ethical care. It is important that the APRN be prepared for situations that may arise. APRNs can participate in educational courses and organizations related to ethics to increase their knowledge, confidence, and skills in ethical decision-making. Due to time constraints, ethical dilemmas may need to be resolved in stages. Physicians and nurses sometimes have opposing perspectives when it comes to an ethical dilemma. Collaboration between the two professions can help reach a conclusion and determine the best course of action. Cultural and religious views can be a barrier between patients and providers. In this case, respect for their differences is required. The APRN cannot let their personal beliefs prevent them from providing care for the patient that is in line with the patient's own beliefs. APRNs need to identify resources within and outside the organization for support in resolving ethical dilemmas. Moral distress can result when there is a lack of support within an organization or environment. It is up to the APRN to assess the level of support and promote a morally habitable environment. An advanced practice registered nurse should be aware of their roles, code of ethics, and use it as a guide. Code of ethics promote honesty, integrity, transparency, advocacy, and equal opportunities. Ethical decision-making is necessary when an ethical dilemma or difficult decision without a precise resolution occur. In ethical decision-making, an APRN should be aware of what our personal opinions on ethical debates or current ethical issues are. Being aware of our own opinions and biases allows the APRN to separate themselves from their decisions. We should gain knowledge on all options for the ethical decision. We should learn the patient or the other party's opinion on the subject causing the ethical decision-making to occur. And next, we should analyze all evidence-based options. Then, we should decide which options are best for the current dilemma. Evidence-based practice will allow for the most relevant and highest quality outcome. After gathering all resolutions or decisions that could come from the issue or dilemma, one should present all options to the party. This party, whether it is a patient or a staff member, should be allowed time to process. The APRN should take in and consider the response. Following the presentation of potential solutions to the ethical decision, the APRN can utilize an evidence-based model, such as a pro-con model, to weigh the risks and benefits of a decision. Then, a conclusion should be drawn based on facts, keeping personal opinions aside. If referring to a patient, high quality, patient-centered care, and safety should be at the center of the decision-making. If an APRN cannot come to an ethical decision, he or she can collaborate with an established ethics committee. These committees use established standards from various parties to help reach the most ethical decision. An APRN can utilize this resource if unable to use strategies before coming to a decision. As registered nurses, we must learn to analyze the steps of ethical decision-making. We must collaborate with doctors and physicians to work through problems. As we transition from registered nurses to APRNs, the responsibility of ethical decision-making becomes more autonomous. As an APRN, we're going to face many ethical dilemmas that we must learn to resolve. We must develop critical skills to apply the analysis of ethical decision-making to our practice, which include gathering information, analyzing the problem, and assessing the outcome. The gathering of information is an essential step in the ethical decision-making process. Most frameworks for ethical decision-making include information gathering as a key step. The outcome of our patients can also be influenced by our ability to utilize the ethical decision-making process. Applying ethical decision-making in advanced practice can be done in many ways. As APRNs, we want to make sure we apply the right ethical decisions in our practice. Ethical decision-making is based on core characteristics like trustworthiness, respect, responsibility, fairness, caring, and good citizenship. Dishonesty, discrimination, and disrespectfulness are not the type of relationship APRNs should develop with their patients. Applying the correct ethical decisions to your practice can help to develop a trusting relationship with your patients. Patient outcomes are better when an APRN has a trusting, respectful relationship with their patients. In conclusion, ethical decision-making is very important, as you can see. As APRNs, we are going to face a variety of ethical decisions that must be made in healthcare. We must learn how to apply these decisions using the ethical decision-making model if we want to increase our patient satisfaction and healthcare outcomes. Applying the principles of ethical decision-making can also have less stress on staff members. As APRNs, we are in the perfect position to apply the principles of ethical decision-making.